Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a severely blocked left ear, and this case was quite challenging for several reasons. The first reason, you may have noticed already, that they've got a very narrow ear canal entrance, and therefore it does restrict not only the insertion of the instrument into the ear, but thereafter the manipulation in order to extract this wax. The second complication is that this wax plug is very dry and it extends all the way from the patient's entrance of the ear canal to their eardrum, and if you continue to watch, you'll get a good view of that a bit later on. You'll see the length of this wax plug whilst it's inside the ear. I'm able to manipulate it in such a way that you can see how far it extends, and you'll see that it's actually attached to the eardrum. Because of the dry nature of the wax, I've just put some drops in there just to help soften the surface. And I'm trying to get a better suction grip, although, as you can see, the sucker is making some contact and I've got some purchase. As I'm wriggling this wax, trying to extract it from the ear canal, I'm easily losing the suction grip. So what you're seeing me do here is really stretch the ear. And I think I'm going to use an ear hook, and the idea is to get in and behind, but because of their narrow ear anatomy, I'm not able to get over the top or around the edge of this wax. So instead, I'm trying to embed the tip into the core of the wax, but in my attempts of doing so, it's inadvertently pushed the wax a bit further in, so I'm just bringing it back out again with the sucker. At the entrance of the ear canal, there was a bit of a sore spot there. This patient does suffer from otitis externa, so a bit of itchiness and dryness of the ear. Otitis externa it's an umbrella term, and it engulfs many different types of ear infections that involve the outer ear. The outer ear consists of the pinna, so the satellite dish, as I like to call it, either side of our ears. So the external dish, the ear canal itself, and then the outermost membrane of the eardrum. So if there's an infection or inflammation of this region of the ear, we label that as otitis externa. This patient's otitis externa is very superficial, so it just affects the outermost layer of the skin that lines the ear canal, and they occasionally get an itch, and they have been scratching the ear at the entrance, and again you'll see that little sore spot that they've got. I've just put some more drops in just to soften this further, and you're going to possibly see now the depth of this wax plug. Now, I decided to use some forceps and to pull this out, and although I managed to get the jaws in, the part of the wax plug that I was able to grip onto, it just cut away. So I was hoping I can get enough grip and purchase that when I retract the forceps, the wax plug comes out with it, but the forceps only, almost like a pair of scissors, it cut into the wax, and so I wasn't able to use that. So you can see now I've been able to separate the wax plug from the canal wall, and it extends all the way from the entrance to the eardrum. You'll see the distal length, so the point furthest away of the wax plug up against the eardrum in a moment. Decided to just see if I can use the forceps again to get a grip, but it's just not enough space in there. There's nothing for me to grab onto. So there you can see in the distance, this wax plug is lodged very deep in the ear. And it's almost like a sausage, so it's got this long elongated structure. And I've just got to be careful every time I'm inserting an instrument. I just don't want to be pushing this up against the patient's eardrum, because that would be uncomfortable. And sometimes that's difficult when you don't get the suction grip you desire, because you're thinking you're suctioning this away, but you're actually pushing it further in. And so you can see I'm bringing this forwards again, and it's just getting trapped here. When the patient first attended, I thought this would be a pretty straightforward one, and it's normally those that they throw you off guard. The ones that you think are going to be relatively straightforward end up being the really complicated ones, and vice versa. And you can see there's very little room for me to work with here. I can only just about insert the Zollner suction probe. I've got a good grip there, and I'm leveraging it forwards, but it's just stopping at this particular juncture. So this surface wax that you're seeing here, the lateral aspect of the wax that's closest to us, we've got it, I would say, in between the first and second bend. We call that the area of the isthmus. It's a narrowing within the ear canal. So we're between 0.5 centimetre and 1 centimetre into the ear there. And I'm just going to see if I can get the hook in and behind again. And with the hook, I'm just trying to roll it forwards, bringing it forwards, and then step by step get further and further deeper into the ear with the hook. Again, it's just really, really difficult. So with the hook, unfortunately, I managed to force the waxwork slightly further in again. So once more, I'm using the sucker, just trying to bring it forwards again so we can have another attempt. Eventually, I'm going to have to use the hook to remove this. This is not going to suction out. Can't really use the forceps because I can't grip onto anything. And because of the consistency, the hook's the only instrument that is going to eventually remove this. And I've just trying to, now I'm going to rotate that hook, I think. And I've just created an opening right at the back, at the roof, and I've got the hook in. Now I just want to leverage this out. There we are. So quite a big piece there. It cut off in two. So this is the more medial segment, which came out without any resistance. So we're going to re-enter the ear. And this patient's ear anatomy is slightly different to the norms. You can see a healthy eardrum there. It's more circular. Most of our ear canals are oval. So the height is greater than the width. With this particular patient, her ear canals, the height and the width are very similar. In fact, you could actually argue that the width is greater than the height in that patient's ear. So instead of having this oval shape, like most of us do with our ear canals, patients' ear canals are more round and cylindrical. And that's a possible reason as to why the wax is struggling to migrate. They've also got a bendy, twisty ear. So this is the same patient, this is their right ear. And you can see that the ear anatomy here, it's more circular as opposed to oval. Very pronounced second bend, so it's almost like a right angle. And I'm just using the Jobson horn just to get away from this soft, sticky keratin that's at the entrance. Because we're on the cartilaginous portion, we can apply a bit of pressure here. This ear, the patient wasn't experiencing many symptoms, but so we removed this more as a precaution measure because given how difficult their left ear was, it's better for us to keep on top, and even if there's a little bit of wax, let's just remove it now before it gets really impacted like it did in their left ear. This patient's right eardrum, you will see it once I remove this bit of keratin, this skin, is somewhat retracted, it's sucked in, and that's because the patient's got negative middle ear pressure. We want the air pressure behind the eardrum to be equal to the air pressure in the ear canal itself, so in the atmosphere, and there's a pressure equalizing tube, the eustachian tube, that connects the middle ear, so the cavity behind the eardrum, to the back of the nose, and that's responsible to ensure the air pressure is equal. It's also a drain pipe, so any fluid that accumulates behind the eardrum, it can drain away. But if that eustachian tube is blocked, there's negative pressure, the eardrum's sucked in, and you can probably see that there. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Thank you, bye.